I'm Dr. Patrick O'Shaughnessy. Thank you for joining us for today's episode of CHS Presents Health Connect. Catholic Health Services is an integrated healthcare delivery system with some of the region's finest health and human services agencies. CHS includes 6 hospitals, 3 skilled nursing facilities, a regional home nursing service, hospice, and a multi-service community-based agency for persons with special needs. Under the sponsorship of the Diocese of Rockville Center, CHS serves hundreds of thousands of Long Islanders each year, providing care that extends from the beginning of life to helping people live their final years in comfort, grace, and dignity. CHS has a commitment to quality, and through this show and many community health initiatives, we aim to promote good health and provide you access to the care that you may need. I'd also like to thank and recognize each of CHS's 22,000 employees and affiliated medical staff members for their ongoing commitment to quality and service excellence, which is evident at each and every patient encounter. You all are the face of CHS, and we thank you for all you do for our patients and residents every day. St. Francis Hospital is New York State's only specialty-designated cardiac center and is referred to as the Heart Center. But in addition to being one of the best hospitals in the nation in cardiology and heart surgery, St. Francis Hospital has also been recognized for providing exceptional care in many non-cardiac specialties, including cancer, diabetes and endocrinology, and nephrology. To tell us about how St. Francis Hospital is more than just heart will be today's guest, St. Francis Hospital's Executive Vice President and Chief Administrative Officer, Ruth Hennessy. Your health and well-being are our primary concerns, so stay tuned to find out how St. Francis Hospital continues to offer the best care for its community and beyond on today's episode of CHS Presents Health Connect.
Once there was a boy who did the same thing again and again. One day, he was told he had autism. He got help and slowly learned how to live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
Welcome back to CHS Presents Health Connect. Joining us now is Ruth E Hennessy, the Executive Vice President and Chief Administrative Officer at St. Francis Hospital, the Heart Center. Over the past decade, Ruth has been instrumental in launching some major expansion projects at the hospital, including the construction of the DeMattis Pavilion with its 14 operating rooms on the main campus, state-of-the-art upgrades and renovations of its cardiac operating rooms, redesign and expansion of its emergency department, and most recently the opening of a large outpatient center at 2200 Northern Boulevard, which is also the home of its Cancer Institute. Welcome, Ruth, and boy, you have been busy.
Thank you very much.
Tell us about some of the hospital's achievements.
We have been focusing for the last several years on enhancing and growing the cardiovascular service line and advancing in new technologies at the same time with that. Part of the additional growth that we have has been within the Cancer Center, and that was a direct outgrowth of the cardiovascular service line. We found that when patients were coming in for their cardiovascular procedures that we were identifying and diagnosing new cancers. We had a lot of clinical leadership that were very excited and interested in developing a cancer center that had the same type of world-class care and expertise that we brought to the cardiovascular service line.
A really incredible achievement. And you find that a lot of your cardiac patients with other concomitant diseases now you're able to serve. What do you attribute some of the success at St. Francis to? You talked a little bit about new programmatic development. Can you tell us a little bit about some of the achievements? Sure.
I think at the core of our achievements is related to our mission.
Yes.
With the founding sisters, the Franciscan Missionaries of Mary, many, many years ago, and they've instilled a sense of compassion and duty to patient care that is well penetrated into the culture, and it's something that we work very hard to maintain. So we have a strong sense of team and commitment to that and commitment to excellence that is throughout all of the programs that we provide.
No question, people are the core of any successful program, and you've got an incredible team. Share a little bit, though, about some of the new programs, whether it be the TAVR or LVAD program that you run.
Just this past year, in 2016, we did our 1,000th TAVR. Wow. For the calendar year of 2016, we did 420 cases. This year, we're on track to do about 600. We feel that we are one of the largest programs in the United States with that. We're also involved with several research trials right now to expand the clinical indications for TAVR, and we're also involved in research trials for mitral valve replacement as well. We really feel that it's very important to be on the cutting edge, whether it's within the development of minimally invasive cardiac procedures, and we also feel very strong about passing that knowledge on to others and advancing the practice of cardiology.
Could you share a little bit, though, about some more of the broader changes you've been making to the hospital's heart failure program? I know that's a new program.
We're very excited about this. We've recently recruited Dr. Rita Germain, who's the department head for congestive heart failure, and we were also fortunate to be able to have Dr. Timothy Vittorio involved in that from a research perspective. That was one of the areas that we knew we had the largest development to do in relative to treating patients, keeping them out of the hospital and keeping them healthy. Dr. Germain is, I feel that she's I'm not going to say a world leader, but at least a local leader relative to the treatment of that. She's board certified in transplant medicine. And has given our LVAD program a huge shot in the arm, quite frankly, relative to the energy that she brings to that.
Oh, no question. And again, you know, this is another opportunity for patients who have had really end-stage heart failure to begin to be medically optimized, which is very challenging. And Dr. Germain and Vittorio run a wonderful program at your Center for Advanced Cardiac Therapeutics. And then, you know, working with some of your new cardiac surgeons like Dr. Lundy and other to consider patients for implant of that left ventricular assist device, which is a bridge to transplant. So really some incredible cutting-edge work being done. Let's take a moment, though, to discuss your chairman of cardiology, Dr. Richard Schlafmitz. We've had on our show before. He's getting worldwide attention for using a new device to better visualize blockages in coronary arteries. He's also going to be chairing a major cardiology-based conference annually in Manhattan. Can you share a little bit about that?
Certainly. It's something that Dr. Schlafmitz has done for the last 3 years, so we're very pleased and proud to be part of this and to foster this. We meet every week with him to go over the agenda and the faculty, and we're gearing up towards that. It's very exciting to be involved in bringing together experts in these new and emerging technologies and to be able to educate providers on this. We find that we've gotten worldwide attention from this.
You're even training physicians now.
Yes, we are. And Dr. Alan Jeremias has joined us recently as well. And he is also a well-documented expert in terms of visualization within the cardiac cath lab.
That's incredible. We have a video that will give us a preview of what's to come.
Because it tells you not only how to prepare a vessel, it also tells you when you're done. Can you hear me, Jeff?
Yeah, we hear you.
Okay,
see
great.
you.
So let me tell you about this case. This is a gentleman who had exertional chest pain, shortness of breath. In February, he had angioplasty and stenting to the circumflex and RCA. What we're doing here today is teaching physicians all the new technology that's available with intravascular imaging, and it changes the playing field. We do live cases at St. Francis that are broadcast
All right, good afternoon.
all over the country. Techniques that we've become expert in over the last 2 years, which is new technology that maybe 1% of the world is using. St. Francis is teaching that technology to other physicians around the country. So I'm going to dilate here, and I think maybe we're just, when you put a stent in, the first thing a patient will say to me is, what's the chance that I'm going to need something else? Am I going to need open heart surgery? Am I going to need another stent? Well, with the technology we have, first of all, we decrease the amount of people going for surgery. 5 years ago, many more patients were going for open heart surgery, but because of things like orbital atherectomy, where we could debulk a calcified lesion, because we could see precisely what we're doing, we're sending less and less patients for surgery, and equally important, our patients are not coming back with restenosis. We're now able to look inside the artery, magnify it manyfold, where we could actually see if there's calcium, lipid, is fibrosis. We see the morphology of the vessel.
And it's very, very important for the community to really understand what the capabilities are in the current catheterization laboratory for understanding what's going on in the blood vessel itself in terms of the blood flow and in terms of the actual biology of the vessel as well as the anatomy. These technologies have been around for quite a while, really over 20 years, but only in the last few years have they really taken a quantum leap forward in really helping us understand the biology and the activity in the vessel beyond just showing that there's a plaque or a clot in the vessel. The important thing here is we're teaching people what's relevant for the clinical practice and improving patient outcomes, and giving them the tools to go back to their clinics and use this every day with authority.
We could, to a millimeter, measure the length of a lesion to determine precisely, tell us the length of a stent, the size of a stent. We could tell if that stent was put in perfectly or not. In the past, you would look at a lesion and guesstimate what you're doing. Here, the technology that's available is teaching us to be the best that we can be. And equally important, it's also decreasing the chance that the patient will have a problem in the future.
Taking a lesson from what's going on in the cath lab, they're actually looking at the absolute blood flow in the coronary arteries as well. So in the future, the CT scan will become the standard screening process. We'll look at the physiology, i.e. the blood flow, we'll look at the anatomy, and then those people who are deemed at risk will go into the cath lab where we apply these imaging modalities in the vessels, and we will be able to select patients better for treating disease and even preventing heart attacks in the future. That's the real golden ring. St. Francis is one of the world leaders in the application of these technologies.
We're putting pacemakers in through the groin where you don't have to put it in through the shoulder. We have devices that help weak heart muscles with heart failure. This is not the future, it's happening now. Because we are a part of this technology explosion, and we're in the beginning where we become experts and we can teach, our mission is to do the best for our patients. That's our mission.
I know we've been talking a lot about heart, but St. Francis has been adding some new beats in terms of non-cardiac specialties. What are the areas you're seeing the most growth in?
Clearly, we've seen incredible growth within our Cancer Institute. We opened that up at 2200 Northern Boulevard, I guess about a year and a half ago. And we have expert medical oncology, we have surgical oncology, we have diagnostic imaging, and an infusion center. It's in a lovely setting for patients that have to undergo this very dramatic diagnosis. We're also very thrilled. We will be opening up radiation oncology at that location as well later on this year. So it will bring all the components necessary for the treatment of cancer care together under one roof to be most convenient for the patients and their family members.
When we get back, we'll show you more on how the Cancer Institute at St. Francis is providing patients with one-stop care close to home.
He helped me learn to read.
It is the best feeling in the world. They impact me. I'm proud of the work that I'm doing.
There's been dramatic results in our kindergarten classroom this year from having a foster grandparent.
Welcome back to CHS Presents Health Connect. We're back with Ruth E Hennessy, the Executive Vice President and Chief Administrative Officer at St. Francis Hospital, the Heart Center. Tell us about the oncology care, Ruth, at 2200 Northern Boulevard. You did a great job explaining the different components of care, but why is it important for our patients to have all of that together in one location?
We've taken great care to develop a comprehensive team of providers for the patients that have cancer diagnosis. It includes nursing personnel, of course, tumor registrars, pathologists, physicians that are focused on that, therapists, social workers, navigators, to help the patient through the different aspects of this very devastating disease. This culminated this past year when we were able to apply for and received Commission on Cancer Accommodation accreditation with commendation.
Yes.
And it was one of those things that we were told that first time out for a program to get that level of success is very rare and unusual. So the team is very proud of this, and they're very proud to be able to advance it. Another component that I didn't mention is the well-developed research program. We're able to offer clinical trials to their patients. If we don't have those trials available at St. Francis, those patients are referred out to other programs that do.
That's wonderful. Let's take a look at what patients can expect at the Cancer Institute at St. Francis.
The Cancer Institute at St. Francis is a very unique place for anybody diagnosed with cancer. Multidisciplinary, high quality, and compassionate care for anybody who has this diagnosis, not just to the individual, but to their entire families. And that's where we come in.
Many patients with cancer from Long Island skip over this area and they head into the city. I don't think there's any reason at all for anybody to do anything like that anymore.
Of course, we're well known for our cardiovascular service line, and we looked at where else we could benefit our patient population. We determined that to develop a cancer institute would be a perfect fit with the clinical care that we already provided to our cardiovascular patients.
Between surgery, medical oncology, and radiation oncology, we can offer everything that has to be given to a cancer patient. St. Francis is accredited nationally. We offer highest quality that anybody can achieve.
We provide our patients with a multidisciplinary approach, a compassionate and a personalized care for each and every patient that comes through the door.
I was beyond impressed from the moment my journey started. Every single person I came in contact with was amazing from the start. It starts with the nurses and the whole staff here. They just came on board right away and made us all feel so welcomed. It's a high level of expertise here.
The Cancer Institute at St. Francis is best in class because the care the patients get here is of a high caliber, which is not easy to get. Nursing, mid-levels, the staff, ancillary staff, right from the top to the bottom, everybody that you come across is here for one mission: to improve our patients' life, health, and give them the best quality of care that they can get.
My husband has been a patient at both St. Francis Hospital and St. Francis Cancer Institute since he was diagnosed. I myself was diagnosed. I firsthand experienced the level of care given at the St. Francis Cancer Institute and by the oncologists at St. Francis. I didn't even think twice about the hospital that I wanted to get my care at.
They are wonderful. They take care so much for the patients.
The great thing about St. Francis is that it has an outstanding reputation of caring. It has expanded, creating a comprehensive ambulatory pavilion in a harmonious, non-hospital setting, to have a full-service oncology environment where patients would be able to be evaluated, have all of their imaging done, their chemotherapy, and have the surgical follow-up take place under one roof.
We're very excited to introduce new oncocardiology program at St. Francis Hospital. Oncocardiology is a brand new subspecialty which allow us to make diagnosis and provide treatment for heart disease due specifically to toxicity of chemotherapy in cancer patients.
We look at the patient as a holistic view.
And that includes their physical, their spiritual, and their emotional well-being. And it's so very important to us. It's part of our mission of healing to our patients.
If my family needs it, this is where I would want to be.
You know, make sure you do your research really well, but I would highly recommend them to come to St. Francis Hospital. Every single person here cares, and that to me means the world.
I'm gonna give her a hug.
Today is my last chemo day, so that is what it's all about.
Boy, what an incredibly powerful video demonstrating the commitment to highest quality care. And as you said, I think best, Ruth, it's cancer care with heart. However, St. Francis is also making great strides in the area of orthopedic surgery. The hospital now had one of the largest volumes of joint replacement on Long Island. Can you tell us more about this development?
Certainly. This is something that we're very proud of as well that's been developed over the last 3 years. We went from doing about 245 joint replacement surgeries to this past year we did 1,300, and that included knees, hips, ankles, and some shoulders as well. We've had explosive growth in that area, to the point that we just formed a separate clinical department this last year, and we were very pleased and honored to have recruited Dr. Richard D'Agostino as our chairman of orthopedic surgery. He's brought on many new advances within the department, and we're really thrilled at the care that we can provide to our patients.
Yeah, it's no question. It's all about the right care teams, but it's also about great leadership, Ruth. And I can see how you've taken and built along that one very strong service line of cardiovascular services and expanded it into so many different areas. Can you tell us a little bit about the nursing care at St. Francis?
Sure. We're very well known for our nursing care. We have magnet designated nurses, and they've achieved that designation for 3 times in a row, which is an incredible feat and an attribute to them. And this is very important because it helps us get our very high patient experience scores, which shows us that we're meeting the needs of the patients and their families in their care.
Yes, there's no question. You know, one of the mantras that we have taken through CHS and St. Francis leads on is don't harm me, heal me, and be kind to me. And the care at St. Francis certainly embodies all 3 of those. There's a lot of competition among hospitals today. How do you see St. Francis evolving over the next 10 years?
We're staying in our own lane. We know what we're good at. We have the expertise that we spoke about earlier today. We don't want to do everything for everyone. We want to be able to focus in on specialized areas and just get better and better and produce better and safer outcomes for patients in those areas. In the future, I would see that the acuity of the patient population that we treat would get higher as more and more patients shift to an outpatient environment. And that's something that we're good at. We're good at procedures, and we're good at taking very sick, complex patients. We already are a referral source within the Catholic Health Services of Long Island system for advanced cardiac procedures, and I would expect that that would continue to grow over the next several years.
Thank you for joining us, Ruth. We'll be right back for my final thoughts and my health tips and solution of the day. Stay tuned. Welcome back. Here are my final thoughts on our discussion today. Where you choose to go for your health care makes a difference. I invite all of our viewers to please research carefully the physicians and care teams that would be responsible for their care, and research the outcomes of that care provided. When you research CHS facilities, you'll see a commitment to the highest quality of care, driving exceptional outcomes, and that was certainly evident today in all of the different programs we discussed regarding St. Francis Hospital. And now for my health tip and solution of the day. Today's health tip is about managing stress. Nearly everyone, myself included, experiences stress in their life from time to time. Some amount of stress is actually healthy, and it's our body's way of signaling either threats or danger, but long-term or excessive stress can disrupt almost all of your body's processes and put you at increased risk of numerous health problems. According to the American Heart Association, elevated stress levels affect your body, mood, and your behavioral health. You may even relate to one of the most common side effects. Stress can cause you to experience headaches, muscle tension or pain, chest pain, fatigue, upset stomach, or even sleep problems. Some other signs that stress is affecting someone could be in their behavior, such as a change in eating habits, drug, alcohol, or tobacco use, exercising less, experiencing angry outbursts, or a general social withdrawal. There are many ways we can take action to control stress before it affects our psychological and then physical well-being. Some general guidelines include taking care of our bodies. We should eat a healthy diet, exercise regularly, and get plenty of sleep. And remember, you can always seek professional counseling when needed. There are also some tips I like to refer to as emergency stress stoppers. If you're feeling completely overwhelmed, try to pump the brakes, take a short break, call a friend, let them know you could use a laugh, engage in some physical activity, or organize your thoughts with a list. It's when we take a step back, we actually feel more able to attack the list of tasks. We all experience stress, but being able to recognize some of these symptoms and get a jump start on managing them can dramatically improve your overall health. You can find all of these tips and more at the American Heart Association's website, www.heart.org. And for more information, watch CHS Presents Health Connect, airing on Telecare and CBS TV 55. To view recent episodes, you can go to CHS's YouTube channel. If you'd like to know more about St. Francis Hospital, the Heart Center, or to make a gift in support of this or another program that is important to you, please visit chsli.org. From there, you can click through to the websites of each of our healthcare partners for more information on ways to give. We are always grateful for the community's support because your gift today helps shape the care of tomorrow. Thank you for watching today. If you have any medically related questions you'd like me to answer on future shows, please do email us at healthconnect@chsli.org. Please include your name and a way to contact you in case we need to reach you. I'm Dr. Patrick O'Shaughnessy, and I hope to see you next time on CHS Presents Health Connect.